Vector-borne diseases are human illnesses caused by parasites, viruses, and bacteria that are transmitted through mosquitoes, ticks, mites, snails, lice, and many others. They account for more than 17% of all infectious diseases globally, resulting in more than 700,000 deaths per year. The most well-known amongst these is malaria, which alone causes over 400,000 deaths per year. Many of these deaths were children under the age of 5 in developing nations such as Nigeria and the Congo. The World Health Organization recognizes many of these diseases are preventable through informed protective measures. The most crucial elements in fighting vector-borne diseases are education and awareness, expedient identification of vectors, and behavioral change. There are numerous static and often dated sources of information online. But what if we had access to real-time location-based alerts and information regarding vector outbreaks? The ability to identify vectors using just your phone's camera, and personalize preventative measures to help avoid such diseases. We believe our solution, eVect Health, addresses an unmet need in the market for people living in developing nations, travelers around the world, and even clinical research settings. It has been well documented that diseases are often spread by travelers. In the following example, we'd like to show you how the app can help minimize the risk of travelers spreading diseases. Here's how it works. This is Becky. As an avid animal lover, Becky has dreamed about going on an African safari since she was a child. After many years of diligent savings, she bought a ticket to go. But recent news articles informed her of potentially deadly vector-borne illnesses on the rise throughout the region. Her friends recommended an app called eVect Health. It's an app that uses machine learning to identify potential vector insects, informs her of potential risks, preventative measures, and how to get treatment in case of infection. Becky uses the Plan Your Trip feature of eVect to input her destination, Tanzania. eVect warns her that there have been 3 confirmed cases of malaria and dengue fever near the countries that she'll be visiting. Seeking to stay healthy, Becky uses the preventative care package of the app. It helps her understand vector-borne illnesses present in the area, how they are transmitted, and areas that present higher concentrations of risk within the country. The app also prompts her to input what type of traveler she is. For example, a pregnant woman, traveling with children, or sick with a chronic disease. This allows for more individualized pre-treatment plans, as different populations carry varying degrees of risk exposure. The app instructs her to receive hepatitis A and typhoid vaccines prior to her visit and strongly suggests she take an anti-malarial drug throughout her vacation. While on her trip in Africa, Becky can stay safe with push notifications from the eVect Health app, which will alert her with pertinent information. Becky is now aware that there is an outbreak of malaria and can use her app to take the right precautionary measures. One night in her hut, Becky realizes she forgot to pack her mosquito net. After swatting at these pesky bugs all night, she remembers the eVect Health app on her phone has an insect identification feature. She snaps a picture of a nearby mosquito, and the app's advanced machine learning algorithm recognizes the insect as Anopheles mosquito, a vector for malaria, and advises her to avoid such bugs. It instructs her to take an in-app questionnaire if she believes she was bit. Since Becky believes she's been bitten by a mosquito that potentially carries malaria, she answers a questionnaire that walks her through common symptoms. Because she does not exhibit any of the common symptoms and had been diligently taking her anti-malarial medicine throughout her trip, the app deems it unlikely she's infected, but recommends she continue to keep an eye should new symptoms arise. If Becky exhibited more serious symptoms, the app would have recommended a more urgent treatment, either to visit a local provider or emergency room, each which are mapped on the app for her convenience.